Well, good afternoon, everyone. Today is April 13th, 2020. I'm coming to you live from the Emergency Management Operations Center. As you'll see today, I am alone today giving you this update, and I know many of you would probably prefer Sarah, but Sarah and Jess over in Public Health are super busy today, so I will be providing the update. And there's probably a lot of people asking why, because we've been usually doing these later in the week, but I thought there was some information that we really needed to get out there, and I wanted to speak directly to the people of the county. So here we go. I hope everyone had the best possible Passover and Easter that they could have this weekend. I know my family tried to make the best of it, and I hope everyone did as well. And today, as we start this week, there's actually some really encouraging news out of New York City, which, as people have started to realize, what happens in New York City is going to have a major impact on what happens to us locally. So when you see a lot of the trends going down in New York City, and they, according to Governor Cuomo, appear to be flattening the curve in New York City, he even said today that the worst appears to be over. So these are good signs, but I would remind everyone that our expectation is, and our best guess is, that the Hudson Valley peak will probably be about a week behind. New York City and Mohawk Valley could be as much as 2 weeks behind. So while there's good news out there, we absolutely need to stay the course. And you know, what they're seeing in New York City is that there wasn't the big spike and then the rapid drop off. They do appear to be flattening the curve, and it is great to get those updates and get that data every single day from the governor. We really appreciate that. But given that good news, now is not the time to rest on our laurels or think this is over. And I'm going to announce today that we are going to renew the state of emergency tomorrow. I originally declared a state of emergency on March 15th. These remain in effect until its expiration in 30 days. So the state of emergency proclamation will happen tomorrow, and that will then take us into May. That can be lifted at any time. However, I do think that likely this will remain in effect for the majority of that 30 days. But, you know, I'll emphasize that, you know, there are some good signs, but we do need to stay the course. And here's some local information based on the latest information that I just got from Public Health. We right now are at 33 lab confirmed positive COVID-19 cases. We have 11 patients, there's the good news, that have made a full recovery. So 11 out of 33, we'll take it. We have 18 in home-based monitoring and quarantine. There's 3 under medical care. And as of right now, we have the 1 fatality. Right now, and you see this number fluctuate on our updates that you see on Facebook, we have about 97 people in public health quarantined individuals. So they're being monitored, and we are working on, you know, staying on top of that, and that number is going to fluctuate. We've gotten some questions as to testing, and you know, there's been some debate. I've seen it online of, okay, we're doing more testing, that's why we're getting more results. It's a combination of a whole host of things. But just to give some people an update, there's been just about 300 Montgomery County residents that have been tested thus far. And I will say, you know, you see the 97 quarantined individuals. There is still a significant number of tests that we're awaiting results. Right now, it's about 3 to 5 days to get test results. And again, that varies. There's some specific issues that could result in a test being sooner than later. But on average, we're seeing tests 3 to 5 days. But a big reason why we're here today is not simply to extend the state of emergency. We know we all probably anticipated that to happen. And you're not here to listen to me reiterate Governor Cuomo's message today. I wanted to talk to you about one of the things that we were most concerned about heading into this situation, and that is what happens if this gets into one of our assisted living facilities, one of our nursing homes. so on and so forth. I know certainly that was my biggest fear. And Sarah couldn't be here today, and they're working their tails off right now. But I do have a statement from Sarah that I would like to read specifically about the one positive test that we have had in the Sentinel in Amsterdam. So again, this is from Sarah Barenko, our Public Health Director. In conjunction with the Sentinel of Amsterdam, we can confirm at this time there is one positive case of COVID-19 in the facility. County departments, public health, emergency management have been working with the local administrative staff to maintain proper cleaning guidelines, limitations on visitation, and coordination of essential staff both coming in the facility and leaving the facility since mid-March of 2020. Having a positive patient related to a nursing facility was a population we worked diligently to avoid, as we know this virus is fatal to those over 55, especially those with underlying health conditions. The staff at the Sentinel has been proactive in communicating the needs to the county for PPE and guidance with patients, staff, and visitors. Staff of the facility continue to follow precautionary measures with cleaning, social distancing, and health monitoring of residents. Montgomery County Emergency Management has delivered supplies to the Sentinel, as well as other community residential facilities that care for our vulnerable populations. Montgomery County will continue to provide assistance to the facility and will continue to assist with updated guidance procedures as per the New York State Department of Health. I knew a positive case was bound to show in a nursing home. I am thankful that at this time it is being handled by skilled staff to prevent the spread in the facility, and grateful that staff is working to keep residents' safety and health at the forefront of this pandemic. Countywide, we are seeing an increase in positive cases, as well as those under monitoring and quarantine. We have been preparing for this. We continue to ask residents to respect social distancing and be apprised that our seniors remain vulnerable and at risk. I know that you want to visit with your loved ones in nursing homes and in residential facilities, but it is our responsibility to keep them safe. So we're asking for understanding, and that came from Sarah, and we're going to continue to do what we can do. As far as the testing goes, and let me just refer to my notes here on this. We had some questions about how, how did this happen? And the patient that did test positive was deemed a risk factor and was tested by her doctor. And then anyone that is in close contact to that positive person is being tested and monitored. So we have a significant amount of tests out that we're going to be waiting the results and following the proper procedures. And we'll update that information for the public as soon as we get that. And that's the one thing we've really been trying to do here with these briefings, with our social media, with our website, is trying to make sure that we get the information out there before sometimes things blow up bigger than they actually are. So right now, just to reiterate, we do have one positive at an assisting living facility in Montgomery County. We are very concerned. This is something we've been preparing for and working on for a long time now, it feels like, and we're going to continue to do that. So just wanted to put people's, hopefully give a little information so people can understand exactly what's going on. We're going to continue to update. Our plan right now is to do an update like we've done later in the week on Friday. And as always, Sarah will be on the radio to answer questions from the community. Right now, we're not seeing a lot of people with symptoms, and there's an abundance of caution taking place, but we're going to stay on it. And, I think the best thing to do right now is stay the course, continue to do what we're doing, continue to follow the social distancing, extend the state of emergency, and take this one day at a time, 1 week at a time. And I ask that those out there extend your thoughts, your prayers to those that are at risk right now, and hopefully, we can minimize, and do our part to try to help this situation. So that's my update for today. We announced the state of emergency. updated our numbers. We had a statement from Sarah, and at this point, we'll see if we have any questions that we can take. Morgan?
There's a few questions in regards to when schools may reopen.
Sure. Well, let's just say this. I'm not speaking on behalf of the school district here, but I will say I've received this question from my wife, who's a school teacher. I think it's going to be very difficult personally to reopen schools this year. But again, I hope I'm wrong, but that's my personal opinion. And right now, what I can tell people is that we're going to continue our state of emergency for another 30 days starting tomorrow. I don't expect that to be lifted prematurely before the 30 days is up, which then puts you into about mid-May with not a whole lot of school remaining. So I would continue to tell people to prepare for the long haul closure, and if for some reason things go better than expected, then we can all be pleasantly surprised together. But my personal opinion is I think it's going to be a real hard time because you heard the governor talk about it today. The issue in New York City is density. And that density issue can have the same problem in upstate New York as it has in New York City. When people are all gathered together, that's when this virus does what it does, which is spread rapidly. So to bring hundreds and hundreds of kids together every single day, my personal opinion, I think is going to be a big challenge for administrators and students and teachers. But again, we don't know. And part of this is the fact that it is uncertain, and we'll just take it as it goes. But my opinion is I think that is going to be a tough and heavy lift.
What is the status of available test kits? Are they coming from the state?
Sure. Well, it's interesting. I can speak to, there's doctors, there's private entities that have acquired tests. As far as Montgomery County goes, like I said, we had 300 tests that have been done. We have just over 100 Montgomery County tests at the moment right now that we can put into action. But again, I would reiterate that there are private entities, just like we did. We went out and bought 150 on the private market to supplement what we were getting from the state. Doctors and organizations do their own testing as well. All that information is then reported to the county. So right now the county has 100, and obviously always looking to acquire more testing, more PPE, all the important resources that we need. But right now, that is what we have and what we're working with, and we're doing our best to utilize those resources. Morgan, I would say that as we go forward, and you saw the governor talk a little bit about it today, as far as what the future looks like for us, significant testing and quick, rapid testing is going to be essential to reopening not only the economy, but our lives again. And that's going to be included in the plasma testing and all the different technology that we're seeing out there. So that is going to be something that over the next 3, 6, 12 months, we're going to have to stay on top of and do as much as we humanly possibly can. I thought it was interesting that the governor said today, he said, well, when's this going to be over? And he said, it's not over until we have a vaccine. And I would agree with that. So how long is it going to be for a vaccine? That could be a year, that could be a year and a half. So the weapons that you have in your arsenal are the testing and the other strategies that are being employed by our health industry. So, but right now we have 100, we have enough. We're looking to acquire more, and we'll take it from there.
I'm not sure if this is something you'd address, but there's a few questions in regards to why are grocery store workers, people working at Walmart, not wearing masks.
Yeah, I mean, that's a question I've been getting a lot. I know in our conversations with, just as we had with the Sentinel, we're giving our guidelines and explaining from the state what the best practices are. Personally, I think I would feel better if I was working at a grocery store, if I was able to have a mask. But that is not in place right now. We certainly encourage that. But again, there's not as much, for example, we've said there's been some calls to, well, why don't you, do certain letters and of the the last name at certain times, and the bottom line is that right now, we're not forcing the private sector, these businesses that have been deemed essential, we're forcing them to follow the state guidelines, and that has not been a part of that yet. We might see that in the future.
Someone who had just got on was wondering if you could rehash a little bit about the Sentinel case.
Sure. So we do have one positive case at the Sentinel. That case was that the person was deemed a risk by their doctor, and right now what is being done is anyone that has close contact to that positive case is being monitored and tested. And I read some very positive words from our public health director about the Sentinel and their reaction to this. I'd also like to say that I personally am very grateful for the local staff we have there that are working hard on this. But right now there are a number of tests out, and the only thing I can confirm is that we do have one positive case. We've been working with them for some time now, and we're going to continue to follow up on PPE guidance with patients, staff, and visitors. We'll also post Sarah's statement online, and that folks can look at that a little bit more, but I won't read the whole thing again. But I will say this is something that we're very concerned about from the beginning, and whether it's the facility in St. Johnsville, a facility in Amsterdam, there's potential to see some real heartbreak here and some real pain, and we hope that we get some good news when we get our additional tests back. But the bottom line is we're not going to know that until we do. But the public can count on the fact that as soon as we get new information, we will share that, and everyone is doing everything we can to contain that one case and isolate that one case and ensure that we do not have a major outbreak at one of these facilities, because we've seen that in other states in this country, and it's about as devastating of a situation as you can get.
Do you have an estimation of how many test results we're waiting on?
Right now, I would say the best thing, I don't want to give an inaccurate number, but I will say it's significant. I will say that I know just with the Sentinel case alone that has generated over 30 tests that we're waiting for.
Okay.
So relative to the amount of tests we've done, it's a significant amount. And that's just the situation with the Sentinel. Obviously, Montgomery County-wide, there's a lot more going on than just that situation. So, we definitely have over 30 related to that we're awaiting results from the Sentinel, and there's others spread out throughout the county. And it's a very fluid situation. So we're doing the best we can, and as soon as we get those results, we'll certainly make everybody aware.
How can the community support our local healthcare workers? Are there any other segments of the community that need help that are being overlooked?
That's a fantastic question. Rightly so. The healthcare workers have been brought to the forefront. The nurses, everyone working at the hospital. But when you look across Montgomery County, there's a lot of essential businesses that are still running. How about our distribution centers that are still, and our truck drivers that are bringing goods throughout the entire Northeast, Target, Dollar General, BeachNut. I'd say, and from what I've seen, there's a lot of people that are hurting right now. We have our deputies, our correction officers, folks that are, working at the grocery stores. There's a lot of pain. That's why we initiated the Take 5 campaign, because if everybody just reaches out to people that they know and people that they care about, and even complete strangers, if it's somebody at a grocery store, to that positive message, uplifting, asking how people are, I think that's what we need to be. I think we need to all try to be better human beings and look out for each other a little bit more than we do. And there's no one that is immune from all of this, Morgan. I would say, everybody has dealt with this in one way or another. Even if you, haven't lost your job and are still getting a paycheck, but are at home with a child and trying to learn how to become a teacher on the fly, it's difficult for everyone. We've seen it. Domestic violence is up. Incidents that the sheriff is responding to are up. People are feeling it. This is different. This is new. This is not something that we want to deal with. This is not something that's going away anytime soon. So I would say, just look out for your neighbor. Everybody's hurting. Everybody's routine and normal life has been thrown for a loop. But if you just reach out to people you know, you can make a big difference. And that would be my best advice, because there's no one sick group that's more important than the other. I think we're all in this together.
Just an update from all the comments. People are saying that there was an executive order for all employers to provide masks to the employees as of Wednesday. So I'll look that up and make sure we get that information.
Yeah, and I'll be honest. I mean, our weekend and certainly this morning was getting a handle of the cases, where we're at, and we'll certainly follow up on that.
Is there a cluster of cases in the county, or are they sporadic across the entire county?
So that's an interesting question, and I have spoken with Sarah about this, and what I'm going to be looking to do over the course of this week. We wanted to be very careful. You've seen other counties have issued maps that will show how many cases you had in a municipality. We chose not to do that right in the beginning for a few reasons. But what we're going to be looking to do over the course of this week is, in addition to the press release looking update that you're seeing online, is also issue a map where people can see the total number of cases within municipalities. Now, I will say this. You have more cases where you have more people. So, obviously Amsterdam has been an area where we've seen certainly more activity, but I would reemphasize to everyone that we are still on our way up. And just because you live in the town of Root, or maybe the village of St. Johnsville, or the town of Charleston, that does not mean that you cannot run into somebody at a gas station and become infected if you're not careful about what you're doing. So, yes, have we seen a little bit more cases in Amsterdam? Yes. But I would say that's more so because of the population. There's a majority of people there. And I haven't seen anything that really sticks out as far as a specific cluster, like say you saw in a New Rochelle, where all of a sudden you had mass gatherings, and all of a sudden you had a major outbreak in a small situation. We've still been very lucky to some extent that we've been able to track these one by one by one by one. But the good news is that we're looking at a map that we can hopefully have this week, and we'll get that to you as soon as we can. And then that way people can see how many positive cases they have within their municipality. But Morgan, I would also emphasize, these are just the cases that we've tested. How many people, and won't know this answer for a long time, have potentially had this self-resolved and now, are past it. We don't know that. Or how many people have it are asymptomatic. So I would say for everyone out there to just still continue to stay the course, err on the side of caution, and follow the social distancing guidelines that's been out there, and that's your best bet, because this is not going away anytime soon.
There's been a few other questions in regards to, if schools don't open, will there be some sort of summer school? How will they pass or fail the kids? Maybe if you just have somewhere to direct them.
Yeah, sure. I think, again, I'm not saying that the schools aren't going to reopen. I'm saying my personal opinion is I find it very difficult to see how that happens. And I think a lot of the school districts have been doing a great job trying to mobilize and still teach during this time. Those are questions that we're going to get the answers from down the road, and I would urge you to contact the school district in which you live in, ask questions, and I'm sure they'll be providing regular updates. But here's the thing, you don't know. And that's been, I think, a lot of the hardest part for people is no one has the answer to that question, because we don't know how far we're going to go. Yes, are there some encouraging signs out there? Yes. Is the governor and the president now talking about reopening America? Yes. But we don't know exactly how that's going to look. And we know we're not going to have a vaccine for at least another year. So how could this potentially even affect the future? So even beyond this school year. So there's a lot of unknowns, and I would say just keep an eye on what the school districts are putting out. I imagine you're going to be hearing more in the very near future as they try to figure this out on the fly, just like the rest of us.
Someone said, I worry that the cases will go up after some families who gathered Easter Sunday were not understanding the seriousness of how this is spread. Do you maybe want to just reiterate the importance of maintaining
that's a
that?
concern for all of us. I mean, we did a drive-by with my grandmother just to say hello, and we didn't, have any direct contact, and, it was different, and it wasn't the Easter that we always know and love, but it was what it was. Some people, I would say this, I've seen a majority of people trying to do the right thing. Are there folks that aren't doing what they're supposed to be? Yes. But I would say keep reiterating to people that, what's acceptable and what's not. We all know it by now. Yeah, I'm concerned. We're all concerned. That's why, the whole, flattening the curve topic is such a big deal. And you're seeing the results in New York City when people do what they're supposed to do. They're seeing the total amount of deaths go down, the total amount of intubations go down. They're seeing, the curve, instead of spiking, it's flattening. That's what we want to see. And, I just keep reminding people that we can do that if we follow the rules. You know what? You're always going to have people break the rules. We have the enforcement pieces in place if we need to go there. And I would encourage people, we had it on the website, and the Facebook and the social media, if you see mass gatherings, call it in. That's all we can do. And we're still getting the responses, and we're sending them to the sheriff and emergency management director, public health director, local police officers. When we're getting, those complaints in, we're following up on them. So we're doing the best we can. It's going to be an imperfect situation, and that's all you can do.
Could you just recap some of the numbers that we have before we wrap up?
Sure. So right now, 33 lab confirmed positive COVID-19 cases. The good news, 11 of those 33 have made a full recovery, 18 home-based monitoring or quarantine, 3 under medical care, and we've had, unfortunately and sadly, 1 fatality, 97 public health quarantined individuals, and we also obviously have the situation at the Sentinel, which we've described at great length. And again, we're going to just do our best to give you the information we have, and if I don't have the answer, I will respectfully say I don't have the answer, but we're going to work on it. So, okay, everyone, so thank you. We'll be back Friday unless something unexpected happens, which I don't think you can rule out. But appreciate everybody doing what they can to follow the rules. Check on your neighbor, take 5. Check out our social media, a lot of great information there. Check out our county website. And then just a reminder, we are extending the state of emergency tomorrow, and I encourage everyone to do your best to stay healthy, stay sane, and try to be well.